If we didn't have funding through the Ryan White program, if our clinic wasn't in the rural community we're in, the people that I provide care for would really have no access to health care at all. When I came to that community, our clinic was just really in its infancy stages, and there were people coming into care with very, very compromised immune systems. Almost everyone that came into my clinic, I met them in the hospital because they had an opportunistic infection. They were very, very sick. So because we're there, we're able to access more people, get them diagnosed, and get them into care sooner.
When you live in a rural area, people know each other more than they do in the cities. How does the issue of stigma and people coming to the clinic and being identified as HIV, how does that affect your practice?
It plays a large part in our practice. It's a huge barrier. It's the reason why some people do not access health care in our community, and some people who live in the community that have the means will leave and go to either one of our neighboring facilities, either in Durham or Chapel Hill, to receive care because they're afraid that someone may identify them as being HIV infected. So in our clinic, we have a unique setup. We are located within a medical building. We don't advertise our clinic. No one knows we're there unless you need to know we're there. We have a front door that people come in where they gain entrance into the clinic, and then we have a door in the back that people, if they don't want to be seen by anyone else who may be in the clinic or someone they're afraid may out their status, we let them go out the back. And if they go out the back door, no one knows where they're coming from. So we do some creative things to try to protect people's privacy. We also have days where we only see certain patients that we know are very sensitive about anyone knowing their status. And also there are people that we know may have communications or may have relationships with other people, and we try not to schedule them at the same time. So we do a lot of creative things to protect people, but stigma and fear of being outed as being an HIV infected person is huge in rural communities all across the South, but it's particularly in these low income areas, it's huge.